Welcome to Glow Up and Get Real. I am the Sweet Face Injector, and I have the Injector Perfector with us today, Amber Shaffer. Thanks for joining me.
Thank you.
So we were trying to decide what we wanted to talk about. And I think what we're going to do is talk about treatments that we have done personally, what we like, what we don't like, what works well, and just go from there. So anything goes. So here we go. Welcome to Glow Up and Get Real. I'm Amy Ingle, the Sweet Face Injector, business owner and trainer. Every week, we're injecting the latest on med spa trends, client concerns, and the boldest new treatments out there. Want the latest in safety, advanced techniques, and business strategies? You're in the right place. So, let's glow up, get real, and level up your beauty game. So, let's talk about your favorite procedure that you like to do on clients. What would you say that is?
The IPL, which is the intense pulsated light therapy, it gets rid of the hyperpigmentation on the skin, like the dark brown spots. A lot of people do not like the dark brown spots from the sun damage. So it's pretty promising. I see a lot of great results when I do it. I've even had it done on myself.
Is it your favorite procedure for yourself?
Yes.
Yeah. And that's because
I get the results
get
I'm looking for.
really good results.
Yeah.
How many treatments have you done?
I would say about 3.
3? And how much time?
They were about 4 to 6 weeks apart.
Okay. And that's really ideal for IPL because, we live in Florida and we're in the sun constantly. Even we can wear sunscreen, but as we get older, we just naturally get hyperpigmentation. So I always suggest to my clients they get like a package of 3 and do it a month apart.
How about a maintenance though?
Yeah. What do you tell your clients for maintenance?
So I say like at the 6-month mark, get one done.
So every 6 months to come in for a tune-up? Yeah, I think that's a good idea. Yeah. So I like IPL too, but you get better results than I do.
I crank up mine.
Yeah, you go high on the energy, which really does help increase, that hyperpigmentation treatment.
Painful.
It's a little wow, but you're tough.
Yeah.
And we can numb too. So I have
Yeah.
clients that are like, it's not really uncomfortable, just a little, but just numb me anyway.
Yeah.
And we can do that. So that's nice. Okay. So tell me about other treatments you've had.
Sculptra.
Sculptra. Yeah. And so tell me about Sculptra.
Sculptra is a biostimulator. It helps promote collagen and elastin to areas that are like depressed, cheek hollows. I had 2 treatments so far and I'm loving my results so far.
Yeah. So your first treatment was 4 weeks ago, 6 weeks ago.
Yeah.
Okay. Your first treatment. Yeah. What did you notice after the first treatment?
Well, of course, after the first treatment, your face is like fluid overload, but yeah, it was fine.
For how long?
That night it kind of went away.
Okay. So kind of all absorbed.
Yeah.
So then when did I actually pointed out to you, I noticed.
You noticed.
I noticed. It's harder for you to notice on your own self because you look at yourself every day in the mirror. But I hadn't seen you in a couple weeks or a week and a half or 2 weeks. And I was like, wow, the Sculptra's working. So do you notice it's working?
The second treatment, I do notice a lot more.
Okay. All right. And that's how many vials did you do?
1 in total?
First treatment.
First treatment, I only did 1 vial because I didn't think I was that bad.
Okay. And then second treatment, 1 vial.
1 vial.
Okay. So typically for my clients, I always start with 2 vials. Do you do that as well?
Yes.
Yeah. So I feel like you just need to boost them with 2 and then go back in 4 to 6 weeks and do a second vial or even 2 vials, depending on the client. So what do you think your final result's going to be? And when do you think you're going to achieve it with the Sculptra?
Definitely before next year.
Okay.
But 1 more and
you're going to do
6 weeks.
You're going to do a third treatment?
I'm going to do the Sculptra challenge.
Okay.
Put them to the test because I have a lot of clients that actually swear by it. And I go, okay, I'll try it. And so
on yourself. That's one treatment I haven't tried. I usually try all the treatments in the spa, and that is one I haven't tried. So you're going to have to inject me with some Sculptra soon. So
Gladly.
So we can talk about it together and I can relate to how it is as a client. With Sculptra, can you explain what it does to your face? How is it different than filler? Like Juvederm or Restylane, how is it different?
How is it different? Well, it's not per se filler. It's not the hyaluronic acid. And it has I'll have to edit that part out.
Yeah. So, well, how do you explain to your clients what's gonna happen?
So they're going to notice like that maybe they won't notice the results the first treatment. Maybe you will. Everybody is so different and it's individualized. So tell them by the second treatment or the third treatment, you should see something from the first treatment per se, because it takes your body about 3 months to get the collagen and elastin in that area. So
So, areas that we treat with Sculptra are mainly
cheek
cheek
hollows.
hollows.
I've heard people doing it in the booty, but I've never done that in the
Mhm,
booty.
mhm. So, Sculptra, you can do in the neck and then the décolleté, in the temples.
Oh, yeah, those. I've done that.
Temples, okay.
Mhm.
Just not in the lips or under the eyes.
Right.
That's no zone.
Yeah.
No injection zone.
Mhm.
Okay, good.
And the cheeks, right? Because
Cheeks you can.
because I was
With Sculptra's cheeks?
I thought, like, the radius goes here, but
Well, you can. You can use Radius or Sculptra
good.
there. Yeah.
Look, see, I learn everything.
Yeah, and Radius is a biostem too, so yeah. Okay, so your favorite is IPL for yourself and for your clients. Well, for you to do. What do you not like?
Laser hair
What? Say that
reduction.
again? So it's loud?
Laser hair reduction.
Yes, okay, so that's so much fun. Not. I don't mind doing it for my clients and it is great to have, but it's kind of frustrating because you can't, it's just not a one and done, really. You have to do a series of like 6 to 8 treatments to
Yeah.
really get a good result. And then hair's crazy, it can like regenerate. And so
Uh,
you might get a patch somewhere that grows a year later, 5 years later, 10 years later. It just can happen. I know when I went on hormone therapy, I
yeah.
had to re-laser my underarms because it just regenerated. I only had to do one treatment and it's good, but that it's kind of interesting how hair can regenerate itself
Yeah.
in the places you don't want it.
Especially I would love it on my head, but,
Love to regenerate in your hair, in your
yeah,
head.
I would like this back.
Well, I think laser hair is great. It's so nice because it can cut down on razor burn. That's what I think most of our clients that come in, they're trying to treat their razor burn, and the only way they can do it is with laser
Yeah.
hair. And
Mm.
so it is great for that treatment, I think. And it really does help a lot. I've seen some really amazing results with laser hair and razor burn not being an issue anymore.
Or
That's
they
good.
get, like, that red irritation.
Yeah, right. The bumps
The
and
red bumps, yeah.
yeah, so that's good. Okay, so you don't like well, it's not that you don't like laser hair on yourself because 'cause you've never done it on yourself,
No,
but you just don't like performing it.
just telling the truth, guys.
Yeah,
Sorry.
that's okay, that's alright. We all have, like, our favorites and non-favorites, so
Yeah.
okay, so what other things have you done?
On me?
Yes,
Okay, so filler, cheek filler,
cheek filler,
chin filler, lip
lip filler, okay.
multiple times lip filler because I like to mess around with the trends, and what was the latest trend? Oh, keyhole.
Oh,
Oh,
yeah, a keyhole in the lip, and you've been
mhm.
doing that, and you even have a keyhole. Did you have a keyhole before? No? Okay, and it looks good.
Thank
How did
you.
you do the keyhole? And can you explain what a keyhole is?
Yeah, keyhole is like a little bit of a hole at the center of the lip, and
Like
I'm
a dimple,
not
kinda?
yeah, yeah. So I tried to get that. You could do it with the upper, lower, or both, like a little indentation or dimple.
Mhm.
How I did it was I took a popsicle stick to the side and while I was injecting, and I just left it there for an hour.
An hour. Do you think that was overkill?
Yes,
Okay.
absolutely. No one do that. I just did it because I'm overkill.
So one thing that I do if somebody requests a keyhole is I'll take dental floss and
Yes.
I'll tie a knot, stick it in their teeth so it's kinda anchored, and they'll pull down the dental floss and inject and
Yeah,
have them hold that.
I like that way better.
Mhm. But I like the popsicle stick because I think it looks really natural, looks good.
Thank
Yeah.
you. Thank
Mhm.
you.
Alright, so your lips, how many syringes do you have in your lips right now?
Kind of lost count at the moment. Well, with a certain product, I've been putting like every 6 months and
A full
then
syringe?
not a full syringe.
Okay.
No, not a full syringe. And then with a different product, I felt like it lasted longer.
Okay.
So I'll get maybe like 8 months
Uh-huh.
out of it, or I feel because it's still going strong, I
Uh-huh.
feel like maybe a year I'll get out of this.
Really? Okay.
Hmm.
Can you tell us what the products are that you're talking about?
Yes.
Okay.
So
The first product,
was Versa.
Versa. Okay.
And maybe because like the product was still in there, but I felt like the consistency was just a little too much thinner. It's for a natural looking lip. I didn't want natural looking. I wanted a little more plumpness, more pout. So I went with RHA3,
Okay.
and I feel like that is lasting longer.
Okay. And I also tell people that, once you have that foundation of filler and then you add to it, you don't have to use as much and if
Right.
you keep up with it.
Yeah.
Yeah. So maybe that Versa gave it a little foundation and the RHA3 could sit on top of that. But it is firmer,
Yeah.
RHA3. So you are going to notice it's there more, I think. And then with your cheeks, how many syringes do you have in your cheeks?
So I would say
Mm.
probably 2 syringes because I started with 1 months ago and then recently did another syringe, like half and half.
All right. Very good. What about your chin? What'd you do there?
Right, J4 right there. And I
Okay.
tried to get rid of the jowls that I was noticing.
Oh,
So I
stop.
created like the I gotta stop looking in the mirror. But yes, and plus my chin is like dull and recessed back a little bit. So I added RHA4 there
Okay.
and tried to create the illusion of like not having the gels.
Okay. All right, good, good. So are you happy with that? Do you
Hmm.
think it turned out good? How much did you use? One syringe?
Hmm.
So you used a full syringe for your chin. Okay.
Yeah, like from here. Yeah.
Mhm. Okay.
Because one syringe is really like a blueberry.
Yes, the amount of the size of a blueberry is one syringe.
Yeah.
We laugh, when people come in and say, "I want this, 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 but I only want to spend on one syringe."
One
And
syringe.
yeah, that's not realistic. How many syringes of filler would you say is in your face right now?
Goodness. Well, the lips have a significant amount,
Okay.
but I would say, let's see, 2, 4, maybe 5.
5 syringes? Okay. So when I come in to see new clients or clients that want to be reevaluated for filler, they'll say, I don't want a lot. I just want to look natural. And so I have to set this expectation with them like, okay, but you need these many syringes. If you want all of this treatment and then they're worried they're going to not look natural.
Right.
So I use myself as an example, and I know you probably do too, because we feel comfortable talking about what we've done
Oh,
to
yeah.
our face.
Oh, yeah.
Some people they don't want to share that information, and that's okay being a client, but I think it's important that we share what we've done on each other and how it's worked because it gives them more of an idea of what to
Exactly.
expect.
Like,
So I always tell my clients, I only do natural. And I'll say, do I look pretty natural? And they'll say, yes. I'll say, well, I have about 8, 9 syringes in my face. And they're like, no way, no way. And I'm like, yes. But if you do it correctly, you do it safely, then it'll look natural. But I have seen some people with what we call pillow face. You know
mm,
what I'm talking about? Where they have so much filler in their cheeks that they look like a chipmunk. I know at one time Tom Cruise had that look. And I don't know if it was from if he gained weight or if he had filler or if it was Sculptra. I don't know, but he just looked overfilled.
yeah.
Uh, and he doesn't now. So, you just have to avoid that. Have to
Hmm.
avoid that. And I've even turned people away and said, no, I'm not putting that much filler in.
Right.
Have you done that?
Yes, I have
Tell me
turned people away, select few that will come in. I want more in lips.
more in their
All I
lips.
see are your lips. So
Yeah.
please,
So what do you tell them? How do you approach it nicely
that I
and
think
professionally?
yeah, that there is enough. I would hate to cause any tissue damage. You are keeping the vessels, you just want perfusion in there,
Hmm.
blood.
Hmm.
Um, you don't want to overfill and create some tissue necrosis.
Right. Yeah.
Yeah, so I'm trying to use layman's terms here. It's a little
Hmm.
difficult. But yeah, so I'll just tell them as an injector, experienced injector, that I just feel it's unsafe. We're hitting that unsafe.
Yeah. And also, say, I think if we put another syringe in your lips, it's not going to look natural and it has a higher incidence of possibility of migration.
Well, yeah, that too. I
Hmm.
definitely tell them that.
Yeah.
It'll migrate.
And I think clients like appreciate our honesty. I mean, I'll joke. I'll say, "Wow, I'm like a really bad marketer. I'm a really bad salesperson because you're wanting a syringe and I'm saying don't do it, And I'm
Yeah,
like, so, but they appreciate that honesty. And I think that's why they keep coming back. I mean, we
yeah.
have some clients that have been with us for 8 years and they're still coming back because they trust us, which is
Mhm.
nice. Yeah. So, what else have you done? I know we talked about a couple other things that you've done in the spa, not necessarily injections, but
On
you've
me?
done, you did a TCA peel, a 30%
Oh, yeah, duh.
TCA peel. Yeah. Tell
I'm
us
like,
about that.
okay, so the TCA peel, I do like it. It does help with hyperpigmentation as well. IPL, I feel, is the best, but it does help. It also gets rid of crepiness after. You're gonna have crepiness during like a week. The downtime, what they say, it's like a week. It's and
Mm-mm.
so your face just looks like it's never had Botox in its life. It's a little tight and you see every little like wrinkle, but that's with the TCA peel process. And then you peel, not like a sunburn peel like that. It kind of, for me, it was a little flaky-ish. And then underneath, like it closed my pores. It gave me a porcelain type of appearance, no wrinkles. The sunspots have definitely lightened more.
I've done a Jessner's peel, which is not as intense as TCA. Yours is a little more intense. Same thing with the recovery. It's like your skin gets dry like a sunburn. It doesn't hurt. It's just really tight,
Yeah,
and you
tight.
put makeup on, and it just looks weird. It this like
It's like
doesn't
everything
look
goes in the
smooth.
crevice.
Yeah, but then once it peels off, it's like nice.
Yep.
Everything is really smooth, and so I try and do those once a month.
Mhm.
How often do you do? You said you only had one
I
though.
only had one because I'm dabbling with Sculptra right now.
Okay,
So,
okay. Now we haven't talked about PRP, platelet-rich
hmm,
plasma. You have not done PRP.
not on me, but on other people.
Yeah, and so tell us about that process.
Oh, it's a
That's like a whole
process.
'nother podcast talking about PRP, which is probably my favorite. I think it's one of my favorite treatments
Mine
now in the
too.
spa, PRP Dermagel. It's something that's new. It's just really interesting. So talk about that, if you could.
Yes. So the PRP, we draw blood from your body and then we spin it. So the red blood cells are divided from the plasma. And then we take the plasma part and the rich part too. And we draw it up in these little syringes and it takes time. About 10 minutes, we put it in a heater, and 10 minutes later, you'll notice that the PRP is a little more like solid. You can't see through it anymore, so it's more solid. And then so we don't burn your face off, we put it in a cooler for 10 minutes, and then we swish it with the PRP that wasn't heated. So that way the filler doesn't look lumpy when I inject it. So
Mhm.
that's the way I do it. I
Mhm.
switch it.
So in the past, I learned 8 years ago, PRP, we draw the blood, spin it in a centrifuge. It would separate the reds from the plasma and the platelets. We'd
Mhm.
draw the platelets out and put it on the face, or
Right.
we'd inject it in the face. Now we can turn it into like a derma filler, which is really exciting.
Yeah.
So when we will separate the platelet rich from the platelet poor, and we will heat the platelet poor and keep the platelet
Right.
rich unheated. And so it breaks the hydrogen bonds. And so when the hydrogen bonds break through heating at 100 degrees
100 degrees.
Celsius and we heat it for 10 minutes, it's
Yes.
like we're cooking, we're in the kitchen. It will make it thick. And if we want it thicker, we could cook it a little longer. Or if we want it thinner, cook it not as long. So it's really like, baking, and then we put it in the cooler, like you said, thank goodness, because you don't want to heat up the platelet rich. So you
Don't
cool
want
it,
that
and
in your
then
face.
you mix the rich with the platelet poor, which is already
Yes.
a gel, and inject it. So I love it because, and I've had it, it makes your skin just look so amazing. I have gotten more compliments on my skin in the last 2 months than I have in my entire life. And I know it's because of the platelets,
That's
the
awesome.
platelet rich plasma dermagel. We also added Wharton's jelly though, last time we did it to
Yes, we
mine.
did.
And that was an interesting process. So Wharton's jelly is mesenchymal cells from umbilical cords is what we use. And we mixed that with the Dermagel, and it was interesting, very interesting. My face was like red and
Was, wasn't
hot.
it?
I had such an inflammatory response. It was like overwhelming almost. But I think I needed that because my tear troughs filled in.
Yeah.
They're not as deep as they were. And I just think my skin overall looks better. My pores are smaller. So I'm a big believer in it. It's kind of a newer thing, so there's not a lot of people that know about it. But we need to tell people about it because it is
Yeah.
great. I think it's really good. What else did we miss? Ativa and BBL, baby.
Mm,
BBL, baby.
BBL
BBL.
and not the broadband light.
No,
It's a the one you think it is. The booty.
the booty. So you've had the Brazilian butt lift with Radius
Radius.
Hyperdilute, and we used 14 syringes of Radius. Now, Radius comes in 1.5 mils, so that's like a 1.5 syringe. So we had 14 of those, and we super diluted it with normal saline
Mhm.
and injected it with a let's see, no, 4-inch cannula. It was a 18 gauge, but it was comfortable. It didn't hurt,
Yeah, it
right?
wasn't bad. You numbed me pretty well. First time, I'm gonna tell him that the first time I had it done, she noticed scar tissue, and I'll
Oh,
tell you
yeah.
guys, I had liposuction like a retard back in my 20s. Maybe I shouldn't use that word. But anyways, we could dub that out. But yes, I had liposuction in my early 20s, and boy, do I regret that. That was a dumb move on my part. But so I wanted my booty back, and I was going to be the test dummy. And yeah, she noticed there was some scar tissue as she was trying to get the radius in the cheeks.
Mhm.
So the second or maybe the third time you noticed the scar tissue had lessened. So that was
Yeah,
nice
it had
to
broken
know.
up a little
Hmm.
bit. It was easier to inject. And so, yeah, and we have pictures. I want to overlay pictures that
Yeah.
we talk about of your before and afters. So,
Yeah.
um, hopefully I can get those up. And so you've had
Three
three
treatments.
treatments
Hmm.
now, and your first treatment was a year and 2 months ago. So we need to do some more pictures and see how it looks. You feel like it's fading away though.
Honestly, but it could be the filler blindness where I'm just so used to seeing my butt in a shape that I just don't even notice. But
Mm-hmm.
I feel like it's
Yeah, we'll have
kind of
to
gone down.
do pictures to see. You though loved it.
Yeah. Oh my gosh, did I love it. Wore leggings all day.
Leggings all day,
Wore leggings all the time.
bathing suits.
Yep.
Um, yeah, G-string bathing suits.
I don't know about that G-string, but yeah.
Yeah. Okay. And I feel like there's one other one that Ativa. So you have not had Ativa, but you do Ativa.
Yes.
Can you explain? That's probably our most technical treatment, don't you think?
Yeah.
For us, it's very
Yeah.
technical.
Yeah. I think the process mostly is the numbing.
Oh
It's
yeah.
such a process.
Yeah.
The lidocaine wash and such, but we numb you so you don't feel anything. And then it's a cannula that has like a tip at the end of it that causes a reaction so that you can have collagen and elastin. You could probably describe this better than me right now, but
Radio
yes,
frequency.
radio frequency. Wow.
That's
Sorry
monopolar.
guys. All that.
Monopolar. And we set the setting up to about 50. I do like 52 degrees Celsius.
Yeah.
What do you set yours at?
Prob-
Depends on what I'm doing.
yeah, it depends on
Yeah.
what you're
I'll
doing.
crank to 60
I
if
have
I'm doing
done
some
that.
lipolysis.
Yeah, I have done that.
Yeah. I had a client with a lot of
I was just gonna say, didn't I do that to you?
submental fat. Yeah. And I cranked that up. I cranked it to 60 and I heard some sizzling going on. I was like, yes, sizzle, sizzle. Yeah. And so that is an amazing treatment. Everybody's had great results with it. It's not a one and done. I mean, you can do one time and wait a couple years to get another one, but we age every day. So I
Right.
say you're going to have to come back and get another one in a year or two because we just age and our diets are bad.
Yeah.
Our diets are bad.
Plus, if you're losing weight and your skin laxity is
True.
happening,
True.
of course that's gonna mess with the results.
Yeah. So it's just a whole bunch of influences on your skin. Age, if you smoke, if you drink, if you don't eat properly, your nutrition's not as great as it could be. And if you're on Ozempic, semaglutide, trizipatide, and you lose weight, you're going to have a lot of skin laxity. That's just part of losing weight, whether you're on the drug or not. It just happens. So we kind of incorporate that with some of our weight loss patients, get them on board to do some treatments after they lost some weight. So, okay. Anything else?
Well, I'll get a lot of clients that have that semaglutide sunken face.
Yeah.
Doesn't have to be semaglutide, but and so I tell them Sculptra.
Sculptra. So, do you know how they came up with Sculptra?
Ooh, enlighten me.
Okay. So, this was I don't know how many years ago. I got to do my research so I can be more specific. And when we talk about biostems, I should be able to tell you like dates and stuff. But
Dang.
they started out Sculptra for patients with HIV that were getting cachectic
Uh,
and sunken face
yes.
from weight loss and muscle and fat loss in the
I heard
face.
it. I wasn't sure if it was legit.
So that's how they started that, and then
Wow.
it worked so well, they're like, "Let's just bring it to the cosmetic industry," and voila,
There it is.
Galderma has, Sculptra in their packet. Yeah, I'm excited to try Sculptra, so
I'm excited to do it.
yeah, but it's one of those things you don't get the results right away, you have
Oh,
to
yeah.
wait. Like filler, instant, like,
Oh,
you
yeah.
see it instant, it's awesome, Botox, toxins, you have to wait a couple of days, but Sculptra, you really have to wait, like, 2 months, really, to start seeing results, and it's very slow and minute, it's a great treatment, and people love it, and when they start it, they usually keep up with it, because if you just let it just absorb and you don't do touch-ups, then you're
Right.
starting from scratch again. You have to do 2 vials to start rather
Yeah.
than 1 vial. So I always say just maintenance, just make sure that you're on the books for in 6 months or 8 months or a year to get your vial, and just
One
like I
vial.
said, tune-ups,
Yeah.
tune-ups. It's all about tune-ups.
I actually had a client yesterday I did a Sculptra on, and she asked me, "Do I have to do all these vials again?" I'm like, "Nah, it's a maintenance."
Yeah, maintenance.
Less.
Less, yeah, right.
So,
Well, thank you so much for coming
thank you for
on,
having me.
having you in the sweet spot spa, sweet, 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 the small sweet. We talked about some things that we're going to discuss next podcast, which is really interesting. The myths, debunking myths
Yeah.
in the Medi Spa.
Yeah.
So you won't want to miss that. So thank you so much.
Bye, y'all.
Thank you for joining us on the Glow Up and Get Real podcast. Here's to fearless beauty and real talk. Until next time.